I am proud to say that, there's really been a lot of rapid growth of specialists in cardio-oncology, but having that specialized training in that area and then also having patients having access to this particular care is still limited. And even those who aren't insured, a lot of times cardio-oncology specialists are not readily accessible to most people. A lot of my research focuses on looking at multimorbidity, and a lot of breast cancer survivors are struggling with metabolic syndrome. And this is the leading cause of disparities between white and Black breast cancer survivors. As nurses, we get it. We can clearly see how social determinants of health impact certain patient populations. But, I think it's important for us to just understand the increased burden of cardiovascular disease on cancer and just finding ways to advocate for health equity and preventative care.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are joined by Lakeshia Cousin, Assistant Professor at the University of Florida College of Nursing in Gainesville, and member of the Greater Tampa ONS Chapter, to discuss cardio-oncology survivorship and the influence of social determinants of health. You can also earn free NCPD contact hours by completing the evaluation we've linked in the episode notes. Thank you for joining me today, Lakeshia.
It is my pleasure to be here. I'm looking forward to an engaging conversation about a very important topic.
Yes, we are too. So just to start us off, can you tell us about your particular area of research and how you have looked at the social determinants of health in that research?
Sure. As a nurse scientist, a lot of my research centers on eliminating breast cancer disparities through culturally tailored psychosocial support to improve health behaviors and outcomes, especially among Black women. And a lot of my work follows under the umbrella of chronic disease self-management, especially breast cancer and cardiovascular disease. So I'm really interested in finding ways to build our patients' confidence in managing their health and keeping them active and engaged in their lives after cancer treatment and into survivorship, especially those who are impacted by social determinants of health. First, we must understand exactly what social determinants of health is, and it all really depends on the circumstance in which we were born, where we grew up, even where we live and work and even sleep. But most importantly, the systems that were put into place to deal with chronic disease and illness. And I witnessed this firsthand as a child growing up in St. Petersburg, Florida, in a lower socioeconomic neighborhood where we didn't have access to certain resources, and how this can impact your quality of life, especially with the availability of healthy foods, safe and affordable housing, education, and public safety, just to name a few. So, when we think of the mechanisms through which social determinants like low socioeconomic status, neighborhood disadvantage, when we have lack of social support, and we can't forget racial discrimination, it really can have a tremendous effect on underserved populations at a micro and an individual level. And today it still remains one of the leading causes of disparities in breast cancer and even cardiovascular disease.
It has been so interesting for me over the past year and a half or so. Some of our other podcasts that we've had, we have also talked about social determinants of health and just some things like that. And it is exciting to hear about your research and how your passion for that came about, and, just in your personal experiences and things like that. And as one of the guests on a previous podcast mentioned, the nurses are, most of times are living where they work and are seeing these things in their communities and such. So I do want to hear about how all of this has really guided your research. So when we're talking about these social determinants and structural determinants of health specifically, how does that affect, you mentioned, patients in oncology, but specifically cardio-oncology?
Oh, yes. When we look at social and structural determinants of health, it really has a unique position among cardio-oncology patients. So when you look at cardiovascular disease and cancer together, they're the leading causes of death in the United States. But we still have this additional burden among Black patients, those who are living in lower income communities, and in also other minority groups. So we still have this problem with incident and mortality disparities in both cancer and cardiovascular disease because of the complex interactions with social determinants of health. Because you have all these different factors that come into play with social factors, economic, geographic, and even cultural factors that can really have an impact overall on health behaviors.
So can you talk about what are some of the obstacles then that patients and providers face when, we're talking about cardio-oncology, but let's look at preventing, these issues that you've mentioned?
So a lot of the obstacles that result in poor cardio-oncology outcomes, they come from upstream factors. And when we think about these upstream factors that providers have to deal with, it involves structural racism and social policies. So a lot of the cultural and historical forces, systemically at times, may have placed certain populations at a disadvantage, really can have a harsh impact long-term on health systems. So now we're currently living in a pandemic with COVID-19, and many of our communities, which were already undersourced, are experiencing difficulties from enormous physical and psychological impact of COVID-19. And then on top of that, you have cancer health disparities that are intertwined with cardiac outcomes because more of our patients are having increased cases of cardiovascular disease. And we have to really find ways to incorporate preventative health behaviors, but it can become difficult at times because we have a double pandemic going on with COVID-19 and racism with a lot of our patients. And a lot of these psychosocial factors are really having an impact on their overall physical and mental well-being.
Well, and in addition to those types of things that you've mentioned, I'm sure that those obstacles are resulting in poorer outcomes for these patients.
Definitely. And we think about a lot of these inequities at a clinical and system-wide levels related to cardio-oncology. But what I've seen in the literature that a lot of all of these disparities kind of fall into four buckets, right? Where we have problems with access to care. A lot of our patients, we need appropriate cardioprotective treatments. And a lot of times, some patients may have to deal with implicit provider bias. And also in clinical trials, we need more diverse representation. So not having an adequate representation in clinical trials can really have an impact. So when we have a lot of these inequities in cardio-oncology, it's because of sometimes the lack of access to specialty care. Now, a lot of prevention with cancer, we think about screening, surveillance, and of course, management of treatment that can be associated with cardiotoxicity. A lot of it is influenced by social and structural determinants of health because you have to think about health insurance status, geographic distance from specialty care. A lot of our patients have these transportation barriers. But I am proud to say that, there's really been a lot of rapid growth of specialists in cardio-oncology, but having that specialized training in that area and then also having patients having access to this particular care is still limited. And even those who aren't insured, a lot of times cardio-oncology specialists are not readily accessible to most people. And on top of that, we have a lot to think about with cost differentials for treatment for cardiotoxicity prevention. And when you add those different socioeconomic factors, all of these can contribute to disparities. And on top of that, you have to deal with expensive medications that can be problematic for our patients.
It's so important to be able to, number one, acknowledge and recognize what these inequities are. And I think then once we are able to do that, the, next step is to really address how do we overcome these barriers. You mentioned so many different barriers that these patients have. And, one I was just going to ask you about, when you talked about clinical trials, even and getting, patients into the clinical trials or being able to have that diversity in the clinical trials. So what are some of the things that are being done to address these inequities that people are recognizing?
I really think that we have to hit it at different angles. Myself, of course, I definitely will start with a possible strategy to attack this through research and continue to investigate research disparities in cardio-oncology and try to incorporate social determinants of health and possibly look at culturally tailored factors that can impact certain patient populations. For example, I'm really interested in finding ways to reduce these morbidity and mortality risk among older Black breast cancer survivors and finding ways to improve health behaviors to lower this cardiovascular disease risk. A lot of my research focuses on looking at multimorbidity, and a lot of breast cancer survivors are struggling with metabolic syndrome. And this is the leading cause of disparities between white and Black breast cancer survivors. So when we think about metabolic syndrome, it's this set of biological factors where you have obesity, high blood pressure, dyslipidemia, type 2 diabetes, or insulin resistance. All of these things have been associated with increased risk of developing breast cancer. And a lot of our patients are having worse prognosis and poorer breast cancer outcomes. But obesity is the major culprit. And when you think about obesity, I think about social determinants of health, and where we live has a major impact on our overall physical and mental well-being. So when we think about residential segregation by race, for example, it's one of the critical mechanisms that impact Black women. And when you think about the neighborhood conditions, it's related to so many different exposures, right? Access to medical care, places to exercise, and providing this preventative care for these patients can be so complicated. When you have your patients living in disadvantaged communities, what can you do, right? There's longer travel time, problems with public transportation, and it could be hours at times just trying to get to the doctor's office because you have to work long hours. And it's just a hard time staying healthy. So I think it's important also at a healthcare level that as providers, we need to make sure we're providing some of the preventative measures like appropriate cardiac evaluations for all cancer patients, not just for racial, ethnic minority groups. We need early referrals to cardio-oncology specialists. And we really need to take time to optimize these cardiovascular risk factors when our patients are undergoing treatments. But we also must attack, these strategies at a community level. Really requires interdisciplinary support to deal with a lot of social barriers that our patients are experiencing. And a lot of times in nursing care, we can do that. We can promote at a community level advocating for social justice or advocating for national policies to help fight socioeconomic disparities. And lastly, I always say this, it's so important that we have more diverse scientists and physicians involved in research, really to help with the patient mistrust that we're experiencing right now, especially in the Black community.
Yeah, well, thank you. Those are great suggestions on areas that we as oncology nurses can start identifying, trying to look at and work with our patient populations that we have. So, we're talking a lot about the social determinants of health, but how does that affect cardiovascular risk and survivorship? You mentioned, some of the things as far as the lack of access to exercise or the difficulty in travel and getting to places. Are there any other things that you could mention that might affect both the risk and the survivorship?
Definitely. When we think about a lot of times looking at mostly the financial strain from treatment can be a big issue, and financial toxicity for our patients is definitely something that we need to consider. And I think it's very important that when I talk about the interdisciplinary approach, we really need to make sure we're incorporating nurse navigators to make sure that our patients have the patient education that we need to mitigate some of the problems that we're experiencing at the bedside for our patients. I know we don't have a magic wand to magically help some of our patients who are living in disadvantaged neighborhoods, but the least we can do is provide the resources, right? And try to establish cultural humility and provide good relationships with patients and family for that additional social support, and also advocate because, nurses, we wear many hats, and being able to provide these referrals to cardio-oncology rehab programs and finding some cost benefits for these patients through social work, for example, can be a great way to help our patients.
I was just thinking that about the social worker and, bringing them on board and making sure that they are part of that care team that we are working with our patients, because so many times as nurses, we are working with them in the clinics, in the hospital, and we recognize what some of those stressors may be, but we might not have the resources, and how important it is to be able to bring in other team members that, may be more involved and know what some of those resources are. So you've talked about some of the stressors among the, Black, Indigenous, and people of color, which we can use BIPOC as the reference to that group right now. In patients with cancer, you talked about unmet social support needs, discrimination, and racism, and those all negatively impact those patients. How does that go along with the chronic disease self-management, and what is it that group, those added stressors that happen with that group of folks?
Well, that's a good question because that's the focus of my research. I've really been trying to examine the cultural phenomenon that really impacts BIPOC people in particular. For example, my work examines Black women, and a lot of times we have this complex called a strong Black woman construct or a superwoman schema, where we may feel obligated to be strong at all times, and we want to suppress our emotions. And, we have to take care of everybody else, and we're not taking care of ourselves. And we look at this social, cultural, historical context at time, it can have a strong impact on self-help promotion for ourselves. And on top of that, we were talking about these stressors, this perceived discrimination, all of these impacting our patients, right? And then this is one of the leading causes of disparities in survivorship care among Black breast cancer survivors compared to white women, because they have lower health-related quality of life, largely due to these social stressors. And I think about the structural and social determinants that we've been talking about. All of this leads to higher anxiety. And a lot of times we may have less social support because we may not speak up. And over time, in turn, this leads to lower coping skills during cancer treatment. So I'm really interested in how all of these contextual factors can influence health-related quality of life and chronic disease self-management among these women. And I really like incorporating a lot of evidence-based complementary therapy interventions. Not to say they're in place of medicine, but it's a really good alternative to help our patients deal with stress. When I was a PhD student, I witnessed firsthand the power of mindfulness-based stress reduction. I remember as a student, Dr. Cecile Lineker was my PhD advisor at the time, and she was working with breast cancer survivors with cognitive impairment after chemotherapy. And working with these patients and seeing them meditate and seeing improvements over time really inspired me to do work in this realm. And I started to dive into different positive psychological interventions. And I've really been drawn to incorporate practicing gratitude in my research. And a lot of these interventions can be practiced at home for our patients. They're even available through apps. And a lot of nurse scientists have been incorporating that into their research. So I really think it's important for, nurse researchers like myself to find ways at a social and cultural level to kind of help reduce social determinants of health for BIPOC patients. And I think a lot of times it really is important just to find ways to where we can reduce implicit bias when we're taking care of our patients. And secondly, finding ways to just provide resources for certain patients who may be experiencing unique stressors like this.
Listening to you talk about your research and how you have looked at the evidence behind gratitude and how it affects mental and physical benefits. Can you talk a little bit more about how that can impact a survivor's quality of life?
Oh, absolutely. A lot of my work focuses on positive psychology. And so I use constructs such as gratitude and spiritual well-being. I published a few articles related to this and actually conducted a pretty neat study among 298 people of color who were at risk for cardiovascular disease. And in my State of the Science review, I looked at the effect of gratitude on cardiovascular health outcomes. And we found that with practicing gratitude long term, it really can play an important role in improving inflammatory biomarkers and also adherence to health behaviors. So when you think about practicing gratitude or just thinking about the definition in general, it's an appreciation, right, for the positive aspects of life. We know there's different ways to practice gratitude, but what I'm really interested in is the long aspects of practicing it. And I really want to tap into the spiritual well-being domain of health-related quality of life for our patients. So in breast cancer research, we know that practicing gratitude is associated with post-traumatic growth. It reduces psychological distress and enhances overall psychological well-being. But we don't know if this is the same for Black breast cancer survivors, and that's where my work comes into picture. I'm really interested in finding ways to incorporate practicing gratitude and spirituality among Black women to see if we can promote behavior change, promote physical activity, reduce inflammation. And I'm curious to see how being grateful can develop thoughts and actions over time. And we have a lot of theories, for example, the broaden and build theory, that over time, being grateful can develop long-term physical and psychological resources. And especially this pertains to those who are living with chronic illness. You have that will for a second chance of life to get better and to do better.
Lakeshia, it's so exciting to hear you talk about that. And I'm thinking about our listeners that will be listening to our podcast and wanting to take information that they're learning from this back to their own practice. Can you make recommendations on what some of those resources would be to help patients, to incorporate gratitude into their experience and not, as you said, not only just during their treatment phase, but to make it a practice, a lifelong practice that is then going to be able to, affect a lot of areas in their life. Can you give us some resources that nurses could use to help patients incorporate this?
Oh my goodness, absolutely. I wrote maybe a year or two ago in Coping with Cancer magazine, I talked about the healing power of gratitude for cancer survivors. And a lot of my work, I'm really trying to find a way to incorporate an intervention that we can implement in a clinical setting. But in the article that I wrote, there's really 5 practical steps that you can take to cultivate gratitude in your life. And as nurses, something that's quick and easy and we can tell our patients during our education component of nursing care. I like to tell people it's very simple. You can keep a gratitude journal. We all know that you can write down what you're grateful for, right? But there's different ways to do that. You don't necessarily have to write in a gratitude journal. You can devote time to do gratitude meditation, where you could think maybe 5 to 10 things you're grateful for. And while you're meditating, just picture in your mind the feeling of gratitude in your body. And just practicing gratitude every day can help develop a gratitude habit and also rewire your brain to help lower your heart rate and just kind of stimulate certain areas in your brain to regulate that emotion and motivation. I like to promote physical activity, of course, in my research. And I always tell patients that, take a gratitude walk, spend 10, 15 minutes just walking outside. Try to do it same time every day. Just during your walk, look around your surroundings. Think about that positive aspect of your surroundings. feel that warmth of sunshine in your skin and being grateful to be able to actually walk. Some of the things that we take for granted. You also can write a gratitude letter to someone who you never had a chance to express gratitude before. It could be a caregiver who's been taking care of you, a healthcare provider. And as nurses, we always know about the Daisy Award, which is, to me, the best way to elicit gratitude. And lastly, in my office, I keep a gratitude wall. It actually is my wall of positivity. And it's very simple. I just leave little notepads and pens and things I'm grateful for during the day, or if I'm talking to a colleague or I'm talking to a student and they say something to me that's positive, I put it on my gratitude wall. And so it's just real simple steps that we all can take and then we can share with our patients to just view and reflect on gratitude.
Thank you. Those are such wonderful ideas. And like you said, they're easy things that we as nurses, when we're working with our patients, can encourage them to do and, suggest or put on our unit. I love the idea of the gratitude wall and how that could be incorporated into a unit, an inpatient unit or a ambulatory clinic. Those are just, really important and great ways for us to know that we as nurses, and when you're working at, the chair side or that point of care nurse who, is thinking, well, I'm not doing the research like Lakeshia is, but what you are doing is incorporating things that can help those long-term outcomes for our patients. And we might not think it's, a lot, but it is so impactful.
And I also want to share, there are some online resources that I like to share with my participants as well and patients. There is a website called Greater Good Magazine, and it's published online, but they have a lot of great free gratitude tools to use. And if they would like to have an app on their phone, there's thanks4.org, which is an online gratitude journal. So if they want to do something quick and easy that's free, there's a lot of online tools that they can utilize.
That's wonderful. I think it's really important to know where those resources are and things like that. So we've talked a lot about social determinants of health and stressors that, patients in the BIPOC community that they encounter. Let's talk a little bit before we finish up, just what that nurse's role is in cardio-oncology preventative care, or just how they can be involved in cardio-oncology and survivorship with patients who are impacted by different social determinants.
Oh, definitely. It's really important, I think, for nurses just to be aware, right, that there's an increased burden that some patients experience, especially with just traditional cardiovascular disease risk factors. For example, high blood pressure, obesity, metabolic syndrome. Black women are at increased risk for this. And as nurses, we already know that hypertension is the most common comorbidity in patients with cancer. And Black women have greater and higher mortality risk. So it's just important to make sure that we have early detection and monitoring and management of these symptoms. And patient education is always so crucial. We talked about the interdisciplinary approach earlier, but we also need to incorporate community resources. There's a lot of preventative healthcare services at certain community centers that can provide free exercise and nutrition programs. And all of these can really help to reduce cardiovascular disease and cancer risk. And also, we want to still consider exploring positive psychological interventions like support networks, incorporating gratitude. And I hope that in the future, my work can reflect that, and just finding ways to improve chronic stress for our patients. And I think over time, in turn, that will help lower cardiovascular disease risk and also improve health-related quality of life in our patients.
Lakeshia, it has been such an honor to take this time and talk with you about, an area that it's super evident that you are very passionate about and something that you really enjoy doing in your work, and just the amazing work that you have done and that I can even hear that you're going to continue to do. As we are finishing up, I just have a few questions that I like to end all of our podcasts with. And we're going to go through them in a quick fire fashion. So the first one I want to ask you is, what are common misconceptions about the effects of social determinants on cardio-oncology?
Well, a lot of times the common misconception about social determinants is that many may think that it's just the patient's behaviors. But in reality, social determinants influence behaviors and has a larger impact on overall health. So when you think about it, it makes sense why social determinants are the why behind behaviors. So we talked about exercise, for example, and we know that that's an important determinant of health. So why won't our patients exercise? We don't know what's going on behind the scenes, that they may be living in a certain high crime area, or they may feel unsafe to work out, or they're having financial difficulties that they have to pay a light bill versus paying for a gym membership, or may not have strong social support systems. You may not be motivated to get healthy. So a lot of these behaviors are strongly influenced by our circumstances. And one way to do this is by, as nurses and nurse researchers, is addressing a social determinants of health to look at ways to create interventions so that we can help improve these outcomes so our patients can perform the right behaviors.
Great. Next question. What's something about the impact of social determinants on cardio-oncology survivorship that's not often discussed, but you wish people knew more about?
I really want to hear more discussion about the psychosocial distressors that are experienced with patients who are not only living with breast cancer, but they're living with cardiovascular disease. And also just some of the evidence that's been out there related to perceived discrimination and racism that's been experienced by Black women. Over time, this is causing, low-grade inflammation, cardiovascular disease. Now, all of these things lead to the extension into the cardio-oncology world, which ultimately causes the lower health-related quality of life. But I just wanted to be able, and through this podcast, which is a good opportunity, to increase the awareness so that we can develop more culturally tailored interventions to help address this problem.
Okay. Now, what additional training or education do oncology nurses need to fully understand the impact of social determinants on cardio-oncology survivorship?
As nurses, we get it. We can clearly see how social determinants of health impact certain patient populations. But, I think it's important for us to just understand the increased burden of cardiovascular disease on cancer and just finding ways to advocate for health equity and preventative care. And I think some ways that we can do this is through supporting health policy changes that focus on those upstream factors that I talked about earlier so that we could just improve overall population health, not just for certain populations in general, but just finding ways to eliminate the systemic and structural racism that has to be a focal point if we want change. An example of that, I recently had an opportunity to work with the American Academy of Nurses, where we were able to develop a consensus paper to define social determinants of health for nursing action to achieve health equity. And I think as nurses, finding ways to, even at bedside, to read up on social determinants of health, be more aware of cultural humility. This is a way for us to really make an impact in social justice.
And lastly, what are some additional resources for both patients and providers who want to learn more?
I learned a lot about the world of cardio-oncology just through experience, but there are a lot of new cardio-oncology guidelines. And one book that I really recommend, of course, it's on the Oncology Nursing Society's website. It's titled Overview of Cardiac Complications Related to Cancer Therapy, that I found to be very helpful. The National Cancer Institute also has great information on cardiotoxicity. If you want to learn a little bit more about social determinants of health, I already talked about the consensus paper that's currently published about defining the social determinants of health so that you can understand the conceptual framework and just establish some conceptual clarity and consensus on what exactly determinants of health mean for nurses. And also just keeping yourselves informed and just having an open conversation with our patients and just understanding some of the barriers that they're experiencing and how does this impact their overall mental and physical well-being.
Again, I'd like to just thank you for joining me today and for all of the information that you have provided to me and to our listeners. I know that everyone is going to really enjoy listening to our discussion today. Do you have any final comments?
No, I really enjoyed the conversation. And, I think it's so important for us to dive into social determinants of health because as nurses, it provides for us the interesting insight into understanding our patients, especially when it evolves around cancer and cardiovascular disease. Now we can understand that there's so many different levels that impact our patients, and just all boils down to just making sure that we provide this preventative care for all of our patients. So thank you for just giving me the time to talk with you today. It's been a pleasure.
Thank you so much for joining me. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.